Okay, ladies and gentlemen, we are into week 6. In this week, we're going to focus on marketing and communication strategies, which can arguably be one of the most important elements of our marketing plan. It can also be one of the elements that requires the most finesse and a lot of decision making relative to targeting markets, choosing the person to whom we are going to deliver our message, determining what channels we'll distribute through, looking at the communications model. So we're going to look at this week first. Again, I'm not going to read through the DQ and the assignment, but I would like you to review those. So pause the lecture, take a few minutes to read through those and make sure you're familiar with what we're looking for in this week's assignments. So as you go through and prepare, you're able to best pull out the material and set it aside to apply to the work that you will do for this week. When we look at who we're targeting, in today's society, we have some really tough decisions to make when it comes relative to marketing and products because of the 4 major generations that we are facing right now, and they're quite distinct and quite different. And they range from, of course, the silent generation, which we consider those between that were born between 1900 and 1945, and then the baby boomers, who are between 1946 and 1964, and then Generation X, 1965 to 1980, and then the millennials, or who we refer to as Generation Y, who basically were born from 1981 to present. If you just follow the news a little bit, you'll realize the distinct difference between these groups based on behavior and things that are occurring. And you have to excuse me 1 minute. I have to pause and put a puppy dog away. Okay, so last we were looking at the difference and variations between the generations. And like I said, if you follow the news and the behavior and just take a little look at how a company like The Gap, as opposed to Molina Healthcare, who sells supplemental coverage for Medicare, Medicaid Part C. So if you were to look at these varying groups and look at how the advertising and how the groups are targeted, I think now that you're taking this course, you may become a little bit more cognizant of the differences. One of the key concepts we're going to talk about is making sure that alignment of the message happens, so that when we target the market and we align the message to that market, we're actually grabbing that market. We're actually leveraging their cultural background, their knowledge, their interest, and we influence their health decisions based upon leveraging and using those particular interests, backgrounds, and demographic information to appeal to those individuals that we are targeting. Now, the 21st century is quite interesting, and it's quite difficult to navigate in many respects when we start looking at the various communication channels. Communication is based upon science and quite a bit art, gut reaction, instinct. It's not an exact science. The science that we do use, we use it to manipulate, draft, and send messages and information to the desired receivers or our targeted market. The art of creation of effective, timely, and sensitive communication that touches the listener and influences him to respond in a specific way is where we're headed to with targeting and messaging our market. Marketing channels in the 21st century are quite diverse, quite numerous, varied, sophisticated, and very targeted with today's social media, internet, and other electronic means. Some of the channels that we will look at are websites, social media, blogs, email, health records, newspapers, robocalls, radio, television, snail mail, which is still used, believe it or not, billboards, flyers, and pop-up advertisements that we get on the internet. I would add to this list pop-ups that we get on our cable TV. just in the last 48 hours after I prepared for this lecture and just started to think about every time I get a pop-up on my cable TV. That is a form of targeting, and that is a form of marketing, and quite interestingly, it's becoming quite a bit more commonplace. Successful healthcare marketing will orchestrate an optimal mix of communication channels and those messages sent through those varying channels. One of the things that really is important, and an element that is more so evident in healthcare, is the relationship marketing. Today's medical environment still relies on relationships between providers and organizations and their patients. Relationships in the last 20 years, however, have become a little bit diluted in the day and age of mergers, acquisitions, health insurance plans changing, physicians leaving markets or retiring, or when we see that people's insurance has changed, then they have to change providers. So that relationship is becoming harder and harder to rely on as a hard element. The foundation of relationship marketing is to develop a strategy that shifts the organization's marketing communications from traditional one-sided marketing to a strategy that continuously builds and strengthens the relationships and loyalty among the consumers and the organizations. When we look at research marketing, we have seen that the relationship marketing is more effective in industries where relationships are more critical to customers, such as healthcare. One of the things that is often overlooked is the electronic health record as a means of communication and marketing to patients. And it's not direct marketing, and we're not pushing a product. By making those records available, however, making the test results available, when we look at the EHR, it actually is a mechanism of building that relationship with the patient, and actually helps the patient to make future decisions and reminds the patient to follow up within a certain period of time, which is critical because follow-up care is one of the ways we can build and maintain our levels of reimbursement. Another overlooked channel for healthcare communication is a physician's website. And many of us are now used to getting on the internet and using the website to schedule our appointments or to send emails relative to asking the physician questions about complications or specific usage directions relative to medications. When we look at distribution, now distribution is important from the concept of we look at the channels in distribution. And we look at some historic channels of distribution, and the early channels were farmer to city to person who purchased the vegetables, for example. That one-to-one relationship has changed, and we now have intermediaries between the consumer and the manufacturer or producer. And when we look at a more traditional channel, rather than today's healthcare marketing distribution channel, we look at a producer who sells to a wholesaler, who sells to a retailer, who then sells to a consumer. When we look at healthcare direct line of distribution, we're looking at the academic medical center to the acute care hospital, who then markets and distributes service and products to the specialist or the medical doctor, the primary care physician, and then of course the patient. We also have in the distribution channel other influences, and I think that's one of the things I would have liked to have seen more covered in our text. Is the other influences would be the farm industry, it would be the over-the-counter industry, it would be other influences that affect our purchasing and healthcare behavior. And when we look at the different strategies for distribution, we look at an intensive strategy, a sensitive strategy, and an exclusive strategy. In the intensive strategy, we look at products such as gum, cigarettes, and soda, where we market to that specific and intense audience that we're targeting most of the consumers for products like that. When we look at a selective strategy for distribution, we're looking more specific products, people who may be looking for a home computer, audio equipment. And when we go down to the healthcare aspect, when we look at an intensive distribution, we're looking at the primary care clinic. When we look at selective, we are now looking at the specialty clinic. And then we look at exclusive, which would be niche or specialty items such as fine jewelry, perfume. And when we look at the exclusive, that would be the academic medical center. Now, we don't hear a lot, nor do we concentrate a lot in today's marketing and distribution schemes on a concept known as horizontal distribution, because that's becoming less and less commonplace. A horizontal distribution, I'm just going to cover here very briefly, would be where physicians are sharing medical space, sharing office space, working together in that space, kind of on a joint venture. Merger or acquisition is also a horizontal acquisition of a similar or like firm or product, or a similar, so a heart clinic gobbles up another heart clinic. When we look at vertical distribution, we're looking at those acquisitions and sales and marketing in the channel to those that are below and provide services to our particular market and to our own target market. And we refer to vertical marketing as the channels in which the intermediaries are integrated so their functions are performed in the most efficient place in the channel. So in other words, when we look at the primary care, then we go up the chain to the specialty physician, then up the chain to the ambulatory surgical center or to the imaging center, and then of course all the way up to and including the medical center. When we look at vertical integration in today's environment, we're looking at several things that drive that vertical integration. And first and foremost is the cost savings by having within your chain of production and distribution those assets that directly contribute to the production and delivery of those services that you specialize in. And that savings can be quite substantial. Transaction cost savings and improved coordination of services, or what we refer to as continuity or continuum of care in the healthcare environment, also has a specific distinct advantage in the vertical arrangement. Also, if we have market imperfections, if we're vertically integrated, when we talk about market imperfections, we don't have enough imaging centers in our particular community to serve the patients that we want to refer. Well, if we have our own imaging center, then we don't have to worry about it, and we overcome that marketing imperfection. The management and internal factors become easier to control. You have more ability to make sure that the providers of services in the chain of production and delivery that you are engaged in actually comply and deliver in means and terms that benefit and maximize your own services. And last but not least, the environmental changes that affect market conditions, production technologies, and transactional relationships. The bigger you become, the more vertically integrated, the more control you have of the market and the market influencers. Vertical marketing systems can be formed by any entity within the channel. We look at Jackson Health System as which is a large integrated healthcare system in Miami-Dade. They do a really good job with vertical integration, and they do a good job with forward vertical integration. And establish the channel of distribution, an organization must decide the level of intensity of service delivery, or how available they will make their services to their own patients and consumers. In order to control the channel of distribution and obtain greater efficiencies, organizations can integrate forward or backwards. So if they're going backwards, that would be acquiring something within the chain of distribution that would be the referring source, and if they're going forward, something that they need to deliver. So we got the primary, it would be a backward, and then for the specialty, the imaging centers would be a forward. The growing formation of integrated delivery in the United States in healthcare is definitely a vertical integration strategy. We are seeing more acquisitions in a vertical nature, more healthcare systems becoming vertically integrated in the sense that they acquire all those means of production within their chain so that they can control and maximize and, quite frankly, in today's pay-for-performance environment, have some control over the quality and services they are delivering to their particular patients. There are 4 models there relative to integrated systems. I would suggest you take a look at those and kind of get a flavor for it, understand how they work. One of the things that really suggests that we are becoming more retail than professional in the distribution and marketing of healthcare is indeed the vertical integration strategy. If you will note, I don't know, I'll make an example from Utah. They have distribution channels for dairies, and dairies now are acquiring the land, and they're acquiring the cattle, or not cattle, the cows, the dairy cows, and they're controlling distribution from the beginning to the end. They control the delivery systems or the trucking industry, and many of them have their own outlets for distribution. When we look at healthcare and we look at communications and strategy, we would be remiss if we didn't break down and dissect the communication model a little bit and take a look at how it occurs. Now, many of you may have had previous courses that are specifically geared towards communication. So when we look at the communication model, many of you may have covered this, some of you may have not. So let's go into a little bit of detail on how the model works. You have the sender, that is the person communicating or conveying the message. You have the receiver, who is the target of the communication. You have the process of encoding or developing the message. And then you have the actual message that has to be communicated. And then you have the channel by which the message is sent. And then on the other hand, you have the process of decoding or interpreting the message sent by the original sender. And then the element of noise or distraction or outside interference can directly affect how the message is interpreted. And when we talk about outside noise or influences, it could be political, it could be social, it could be environmental, it could be language issues. And then finally, in the loop of communication, we do have that feedback cycle where we go back to the beginning, and if the receiver doesn't fully understand the message, they have the opportunity to clarify the message. Where we're seeing in the 21st century a very critical role and opportunity is the decoding aspect of the message. So when we look at our target audiences, we may have to encode in a different language. And as we have seen in the 21st century, we have seen that the decoding is being targeted more so to Spanish-speaking individuals because of the amount of immigration we've had from Mexico and Latin American countries. They have a great chart. I put it figure 11.1, which actually identifies the loop. When we look at the communication channel, we look at, is it going to be written? Is it going to be spoken? Is it going to be through other means, verbal or nonverbal communication? Nonverbal could be gestures. It could simply be pictures. It could be many things. The true goal of a communication is for the sender to transmit that information so clearly and perfectly that the person who is receiving it understands it exactly, and they understand how it is intended to be understood and acted upon. And here's the key, of course, in marketing and healthcare communication is the action. We ask people to act upon what we are conveying in our message to make decisions relative to one of the most personal and intimate decisions one will make, and that is his or her or a family member's health care. When we talk about noise, gender noise seems to interfere more than anything, and that, I think, has been broken down considerably. But when we look at gender noise, we often look at interpretation of capabilities of physicians, female versus male. And that could be an inverse relationship with nurses, male versus female nurses. I think we also are seeing today more so when we talk about noise interfering with the communication is language barriers, accents, cultural, ethnic concerns relative to our providers. Provider may very well be qualified, but if they have a heavy accent and are very hard to understand, the process of communication leaves a little bit desired in the component of trust and faith in that particular individual. We are overcoming that, but that is still an issue in the healthcare environment. One of the things that was not covered, and I think I would love for you guys to understand, because I think it's kind of important, and that's the concept of information asymmetry. And when we talk about asymmetry in the healthcare environment, we're talking about we turn to our physicians, and we actually ask our physicians to a great deal or a large extent to be our agents, to make those decisions for us that we aren't capable of making because we do not have full information or knowledge relative to a disease or condition. Now, I would suggest to you that some noise relative to healthcare communication is creeping in relative to the internet, WebMD, Ask a Doctor type programs, where patients are indeed reviewing that information and are bringing in to the conversation sometimes accurate, sometimes what I would consider noise and inaccurate information, and asking the doctors to act upon that. Health communication often concerns far more than just the sale or the kill. And I use kill as when that's kind of probably not a great word to choose, but the kill is when you go in to make that final sale. It's referred to in marketing. It's hard when we're looking at public health decisions, social marketing, and health education from the standpoint that we are dealing with such a diverse group relative to level of education, ethnicity, age, language, health condition, cultural and religious beliefs and aspects relative to medical choices, and a asymmetry in general understanding knowledge of one's own health. I think when we start looking at the communications and we look at how the web has created such a diverse and widespread array of information, when we look at figure 11.2, it just demonstrates how many different sources of information and communication points of source that one can acquire from the web or the internet. When we look at 11.4, and I found this quite interesting because I'm not a big fan of memes. And quite frankly, the political memes and some of the social memes, some of the issues that are presented in memes can be very misleading, inaccurate, and offensive at times. But if you look at this map of how memes work, how memes are distributed, how they can be used as a platform, how they can be used for positioning, look at some of the core competencies that can be conveyed in a meme. If a meme is used appropriately, can be quite effective and can convey quite a few messages and quite a few concepts in one particular hit on a social media site. The next thing we look at is the message itself. And when we look at a two-sided message, which is becoming more commonplace in today's medical and healthcare environment, we're looking at a message where both the pros and cons of decisions being made. We look at the pros and cons of prescribing of medicine, and I would suggest in some instances the cons are more inclined to be highlighted because of today's litigious environment. When we look at that comparative message, we look at, in one of the simplest comparative messages, we look at our competitor, we look at ourselves. Who's better, who's quicker, who's faster, who has better quality of care. We send those messages out on a regular basis. Perhaps a couple of your students have brought up in the discussion question, perhaps it hits home. going to the urgent care or the emergency room, we look up at those billboards, wait time. That's a comparison. Our wait time is 11.2 minutes. Check on your competitor. They may be 40 minutes. That's one of the simplest comparisons, and we see it on a regular basis on those billboards or on internet programs where you can go in and you can look and see what your wait time is at the various emergency departments. Healthcare, we do really see a lot of the emotional appeal being used in the communication process. And the creation of any message involving the determination of the level of appeal will determine how one reacts and responds to that particular message. Emotional appeals can take the form of fear, humor, or sentiment. Emotional appeals aim to focus more on feelings or self rather than on utilitarian purposes. You will feel better. You will be happier. You will come out more satisfied. And then when we look at the channels, and we listed a bunch of channels above, the robocalls, the snail mail, the internet, the email, all of those channels are the means used to deliver a marketing message. In the promotional mix, we look at our message and our target audience. We look at and review the advantages and disadvantages of each of these channels in greater detail to understand their effectiveness. One of the things we look at is social demographics, age, gender, interest. Where are you in the life cycle? Some ads will be very effective when people are in the later stages of life cycle, whereas opposed to the young kids in the millennial group in their 20s and 30s who still feel they are invincible, the messages may not appeal so much. When we look at the major advantage of advertising over publicity in terms of what is said and to whom it is said and how often it is said and how it is said, we have to look at publicity having greater credibility because publicity is normally in the form generated through media, news outlets, coverage through various professional organizations. On the other hand, we look at paid marketing differently because many of us, when we see a commercial, we may be thinking, well, this commercial is dubious in its claims. So that's where we're running into one of the problems with communication in the 21st century is that difference between, and I hate to use the term, but I'm going to say inaccurate rather than fake news because it's condoned and put on a news channel. Many see it as more accurate than it would be if it were just part of an infomercial or advertising. When we talk about earned media, that's the media that we earn through our organization, through our customers and word of mouth, and our customers become channels and conduits for our message and the information and message that we want to send. There are a few miscellaneous points I'd like you to go over. I'm not going to go over here in detail. If you have any questions relative, please let me know. Module 6 worksheet. Please make sure, ladies and gentlemen, to use the worksheet. It helps me when grading following, and it also helps you because it ensures that I see that you've met all the points contained on that particular worksheet. When you're going over your worksheet, you're going to pick 3 target markets and demographics for those markets. Once you pick from the list that's provided, which starts out with low-income Hispanic and ends with affluent white people, you will select a department, program, or service from the Missouri Department of Health and Senior Services. You're going to prioritize your target market demographics as priority 1, 2, and 3 based on the program initiative that you've selected. You're going to identify the marketing technique you will use for each priority. Again, when we talk about technique, we're talking about message, target, communication style, channel. You're going to look at and describe and discuss briefly your prioritization of that technique that you chose. You're going to address how the communication and marketing strategies align with the department, program, or services mission, vision, and values. And they give you an example, priority 1, white, low income, oral health, etc., etc. So then when you look at your DQ, ladies and gentlemen, I would like you to consider just above and beyond stating, oh, this is the choice I'm making relative to the specific communication I received in my professional life from an organization leadership, and assess that communication strengths, weaknesses, in addressing the organization stakeholders. I would like you not to just concentrate on the message, but concentrate on the different aspects of healthcare marketing and communication that we discussed during the last half hour. When you look at it, what change was communicated? How was it communicated? For example, you may be informed about a change in your organization. The CEO may come up and introduce a new program, strategy. Specifically address the strengths and weaknesses of that leadership's communication. And that's where you're going to want to look at when you're looking at the strengths and weaknesses. Some of the things that will come into play is channel, message, how the communication is structured, the tone of the communication. Is it targeted to the right market? If it's targeted to the right market, is it hitting on the right aspects of that market or that target that you've specified? So you're going to look at all of that, and you're going to discuss why it was a good decision or a bad decision to communicate the information in the forum and how it was communicated. And as always, if you have any questions, please email me, p.vanash@snhu.edu, or feel free to call me at 801-940-2531. Thank you.